Ragweed allergy. There are many types of allergies that affect people in many degrees and cause various symptoms that may affect their daily activities and general health. One of these allergies is ragweed, which has many effects on people's health. There are many types of ragweed in North America. Two types of ragweed are abundant. We have common ragweed and giant ragweed. Ragweed allergy happens when the person's immune system is sensitive to the pollens of ragweed. The immune system releases compounds that its job is to contain the pollens, and also they are the signal for histamine to sprout. The histamine then goes to the pollen place and alert the body by itching and swelling. Another noticeable symptoms that the person may experience are red, watery, and itchy eyes, runny or stuffed up nose, and maybe prickling mouth or ears. We have also sinus pressure, which could cause a pain in the face, and general sickness that may affect the quality of life and impair days and outdoor activities and impact nights and cause poor quality of sleep. Make a certain adjustment in an everyday living is very important and helpful in reducing ragweed allergy symptoms. People who suffer from ragweed allergy should take extra caution and be creative and create ways to minimize exposure to the ragweed pollen and reduce it to the minimum levels. We have some extra cautions that the person can take. Close all windows in home and car. Use certified asthma and allergy friendly filters. It's better to change all the clothes, washing them, and take a shower. Wash the pits or brush them after playing. Washing bedding every week in warm and soapy water. Don't hang the clothes out the allergy season and use the dryer instead of that. It's better to vacuum the house every week with a vacuum cleaner that has a HEPA filter. Moreover, all members of the family or any visitor should take off shoes out home on the welcome bed to reduce pollen from entering the home. It's also helpful to clean and remove the decaying. It's better to go outside in ragweed allergy season just in morning or in the late afternoon and avoid going outside between 10 a.m. and 3 p.m. because pollen levels are high during these hours. If the person has to go outside between these hours, it's recommended to wear a mask. There are pretty useful websites that can provide us with the pollen forecast in the next 3 days. This allergy outlook can tell us specific information about the different types of pollens and their concentration in the air, whether they are high, moderate, or low. These pages can help in tracking the pollen count so people can stay home if it's active and avoid peak hours. Some kinds of food make ragweed allergy worsen, such as honey, cucumber, sunflower seeds, melons, chamomile tea. That's because the protein in this food is same like the protein in a ragweed allergy, so they make the same symptoms. Some kinds of food that make ragweed allergy better we have like garlic, hot peppers, salmon, fatty fish, and turmeric tea. Many kinds of medication would be really helpful to make the allergy season easier for you. Many allergy medicines are available on the counter, but it's better to see your family doctor who can consult you your issue and give you the proper medicine and be aware to the side effects and then send you to the allergy specialist if needed. We have nasal steroid, the first choice of treatment usually doctors suggested, but you need to have plan ahead because the steroid works effective if the person uses them weeks before the ragweed season starts and start taking them. They relieve congestion, a runny and itchy nose, sneezing, and other symptoms. The steroid may be taken by month or sprays to treat nasal allergy or as eye drops to relieve itching. Some of the sprays needs doctor prescription and some of them no, they just you can buy them from the counter. Antihistamine are medication that works against the histamine that makes you feel sick. You can take them as a nasal sprays or pills. They relieve itching, sneezing, and runny nose. The nasal sprays work on congestion and itchy, runny nose. Some of these antihistamine work for a long time, which make the person drowsy. So if anyone need to take this kind of medication, he should be aware not to take them in the day because they may make him drowsy and so he can't drive or work. Allergy shots, or as the doctors call them, immunotherapy, are shots that retrain the person's immune system so it doesn't go into allergy mood. It's suggested for patients who suffer from ragweed strongly years after years. When the patient takes an allergy shot, the doctor gives him small amounts in the pollen gradually. The doctor will increase the amounts of pollen every week or month until reaching determined percentage. This type of cure is long term and it takes about 5 years depending on the patient responding, and then the doctor will decide if the patient needs more or not. It's a long time, but research point out that the effects of the shot last for lifetime. The procedure divides into build up and maintenance phases. The build up phase is kind of hard one because the patient needs to come twice a week for about 6 months to help the body use the allergens. The maintenance phase can be once or twice a month, and then the patient's entire his face. This phase is when the doctor and take the vaccine to make the reaction under control because serious reaction appears within the first 30 minutes. Also, there's under tongue cure, which is tablet that taken by the mouth and give some results like shots. For best result, similar to these from shots, it's better to take the tablets every day from April until the end of ragweed season. Some people have a strong reaction to the tablet, but as general effect, the patient may feel itchy mouth or have a stomach ache. Both of the shots and tablets work on both the tolerance of allergy triggers.